Good afternoon. My name is Ronnie Howard, and I am a MSW student with at George Mason University, and I'm in my specialization year. All right, so this is my virtual CV. I want to give a brief overview of who I am as a person. Not only am I an MSW student, but I am also a 15-year Army National Guard service member, and I do behavioral health support within the Army National Guard. I also coach high school wrestling, and I say these things to say the everything that I do professionally is geared towards helping others because I care about people, I care about the community, and I want to be able to give back. Within George Mason, my pathway is the adults and healthy aging pathway, and my overall goal is to become a licensed clinical social worker. My intention is to be able to give back to the underserved communities. I am currently in the process of completing my practicum with the DCVA medical facility, and it is a hybrid placement where I work within two programs. The two programs are the Mental Health Intensive Case Management Program, or MICM, and their Trauma Services Program. My supervisors, one for MICM is Janelle Thompson, and my supervisor for Trauma Services is Mr. Sean Olimsky. Within the two programs, so the MICM program is a volunteer program that provides intensive, flexible community support and improves veterans' health by reducing psychiatric symptoms. The intent is to reduce hospital use and dependency and improve community adjustment, functioning, and quality of life. We also utilize an interdisciplinary team approach to clinical case management. For the Trauma Services Program, there I co-facilitate a STARE group. The STARE is an acronym for Skills Training in Affective and Interpersonal Regulation. That is a group geared towards veterans that have all been diagnosed with PTSD. So my role in the MICM program is to provide clinical case management services. I assist veterans in meeting identified treatment goals that facilitates maintenance and stability of mental health symptoms. The MICM program is where I spend most of my time. Yes. And the STEER program is where I'm there 1 day a week. So here are the skills, and here's a brief overview of my social work skill set that I've been able to develop just in this one program alone. That doesn't even include my Army National Guard behavioral health background, which you will find on my resume. That doesn't include my coaching background, which you will find on my resume. Just all the things that I've been able to do within my graduate school practicum. So here I've improved my clinical assessment skills by conducting home visits with veterans weekly to monitor symptoms. So as I mentioned before, within the MICM program, we are providing clinical care in the least restrictive environment, and so we are doing home visits for our veterans. It's almost like a sort of community care, within the county government. Also, because our veterans are all diagnosed with serious mental illnesses, we are always assessing, right? So we're assessing for symptomology, right? We're assessing for needs. We're assessing for baseline just to make sure that there's no deviation, and trying to determine if there is, where the deviation starts or lies. This is weekly. I also assisted veterans in navigating their mental health care within the hospital system. So the VA has a variety of programs and departments. Veterans have to try and navigate that alone most times, but with our program, we are clinical case managers. So not only are we assisting veterans in their health care, but in their mental health care, but we're also helping them to make sure they're taking care of their overall health care. So that means helping veterans to connect to their primary care physician, helping veterans to connect to any specialist that they may need, helping veterans to connect to any additional resources such as trauma services, or the CWT, which is community work, right? A community work program. I provided supportive counseling to veterans during STEER group and during home visits with MICM veterans. Not only have I co-facilitated groups, but I've also led the STEER group. And the STEER group is a time-oriented group. The sessions are an hour and a half over the course of 12 weeks. And there is a specific structure to the groups that we follow on a week-to-week basis to progress veterans towards being able to manage their PTSD symptoms overall. I've conducted multiple comprehensive psychosocial assessments. That is where we are onboarding. Whenever we onboard someone into the MICM program, which is a volunteer program, we have to do an overall comprehensive assessment, and after we do that assessment, we then connect veterans to care. I have continued to keep veterans involved during the treatment planning process to maintain the autonomy of their mental health care. That is just something that aligns with the NASW. That is an aspect that aligns with the NASW Code of Ethics for social workers. Right? My undergraduate degree is in human services, so I was new to NASW and their Code of Ethics. And as I've learned their Code of Ethics, I do have the understanding that we are allowing clients to the autonomy to be leaders in their health, be leaders in their mental health care. And then I've utilized my care coordination skills to assist veterans in navigating hospital departments while managing healthcare needs. And that is something that I mentioned before as far as assisting veterans in managing and navigating the hospital. So not only are we helping veterans to navigate the hospital, but if they need any care needs in the community, I assist there as well. And then lastly, I've been working on the interdisciplinary team that includes myself as a social worker, our nurses, the nurse practitioners, and the adult living facility staff for any of my veterans that live within assisted living facilities. I hope this has given you all a brief overview of who I am, the skills that I bring to the profession, and I look forward to hearing from you in the future. Thank you so much.